Welcome to 6ABC's Weekend Extra, paid for by Mainland Health. Here's Jessica Boynton.
Finding lung nodules in patients is on the rise. Some turn out to be a benign condition and some turn out to be cancer. Without proper detection, there is a risk of delaying cancer treatment. And new technological advances in detection, diagnosis, and treatment are helping physicians take better care of patients. Today, we have Dr. Pat Ross, Chair of Surgery at Mainland Health, to explain what lung nodules are and about the innovative diagnostic imaging and treatment available at Mainland Health. Dr. Ross, thanks so much for being with us today.
Thank you, Jessica. It's a pleasure to be here to talk about such an important issue in oncology.
Yeah, and you know what? We're going to start with a really important question too. What is a lung nodule?
Well, a lung nodule is a spot on the lung that is not part of the normal lung architecture. And it can be there for either benign reasons, which turn out to be of no consequence, or it can be there for malignant reasons, which obviously mandates identification and therapy for the patient.
So how common are lung nodules, and are they always a major concern?
Lung nodules are increasingly common as we pursue diagnostic studies for many reasons, not just lung health. We find lung nodules serendipitously on scans, and that always represents a source of concern for the patient and his or her physician as they try to determine, is this one important or is this one safe?
What are some of the challenges in caring for patients with lung nodules?
The first thing we have to do is characterize the lung nodule to be sure that we understand why it's there. We never want to miss a malignancy. And identification of lung nodules that represent early lung cancers is really one of the best ways that we have to promote more cures for patients with lung cancer. It's also important to recognize that lung nodules can be found in patients who are having surveillance scans for other solid tumors like colon, prostate, breast. And when we find those nodules in those patients, our concern has to be, does this represent a malignancy, a progression of their disease, or does it represent a new early cancer of the lung? So these are complex questions, and this new technology helps us navigate through.
Now, what is robotic bronchoscopy?
Robotic bronchoscopy is an innovation to traditional bronchoscopy, which allows us to get all the way out to the periphery, meaning the edge of the lung. Traditional bronchoscopy would never let us get there. Robotic bronchoscopy makes a CT scan of the patient's chest with the knowledge of the anatomy to allow us a GPS-guided pathway to get right to the lung nodule and very specifically make a diagnosis of what that nodule represents.
Now, how does robotic bronchoscopy help manage patients with cancer?
Finding an early lung cancer is the greatest chance that we have, the greatest opportunity for cure, and that's what we want to do. So identifying a lung nodule that is an early lung cancer gives us an opportunity to treat that patient before it progresses to another level. And equally important, identifying a lung nodule that represents a spread of a previous malignancy is important for that patient's therapy. And finally, identifying a lung nodule which is benign is a reason we can all celebrate.
And where is robotic bronchoscopy available at Mainland Health?
We have the technology available at Lankenau Medical Center. We do them all there as part of a cohesive team in thoracic oncology involving pulmonary medicine, thoracic surgery, anesthesiology, pathology, and all the infrastructure and support that lets us have a wraparound program to comprehensively treat patients with lung diseases.
Wow. Dr. Ross, thank you so much for being with us today and bringing awareness to such an important topic.
Oh, thank you, Jessica. It's a pleasure to contribute to our city's health.
Now, 6ABC and Mainline Health are proud partners of Well Ahead Philly. You can visit wellaheadphilly.com for more information to help you manage your health and live well. Thanks so much for watching.
Well Ahead Philly helps you gain access to the information you need to feel better and live well every day. Thanks for watching 6ABC's Weekend Extra, paid for by Mainline Health.